A large mid-pelvic region mass, cystic, complex mass. It is cystic as well as solid. It's a large mass, and the patient is a female, female with history of hysterectomy few years back. Now, basic complaint of this patient is anemia, and we are seeing a mass in the pelvic region, uterus removed, measuring approximately 14 into 6.5 centimeters. It is complex, has cystic and solid components with echogenic areas scattered throughout it. These are the calcifications. These white linear areas that we are seeing are the calcifications within this mass. It's well demarcated. See the outer surface, and this is the debris within it. This low-level debris seen in it, and you see this is mass with peripheral blood flow, as well as there is some internal vascularity as well, but that we will see later on by decreasing the size of this mass. You see, this is the typical artifact, twinkle artifact, which we see in cases of in calcified areas, calcifications. This is a calcification, and this is the twinkle artifact from it. So numerous calcifications, mostly in the center of this mass. The periphery of the mass is relatively spared by these echogenic particles. Now you see there is some echogenicity within it. Okay. Now, having seen this, now this is a transverse view of the mass. This is the right kidney, and you will see there's massively hydronephrosis, and there is total loss of the parenchyma. No parenchyma seen, capsule is seen. This is all hydronephrosis, and now this is the ureter emanating from the kidney. This is the hydronephrosis kidney with dipping sign, and this is the ureter. Dilated ureter measuring approximately 14.2 up to 7 is normal. Now when I follow this ureter, now first let's see, it is ureter or vessel. No blood is being taken by this tubular tubular area. So this is a ureter, and now I am tracing it down up to the pelvic region. Here, just to show you again that this is a ureter and not a vessel. No blood is being taken by it. However, these are the iliac vessels down. Now you see the mass is here. This is the mass. This is the mass, and this is from where the pressure on the right ureter at this end has led to the destruction of the kidney. Total, it has lost, the kidney has been lost, it's totally hydronephros, no parenchyma seen. So, you see, here it goes, this is the ureter, here the mass effect from the mass blocks it over here, and from back pressure from it, long-standing, the right kidney is gone, many because of massive hydronephrosis at this time. Let beta sidio. However, the left kidney is preserved. That is the why she is living, I think, so far. Though the mass is of aggressive nature, it's not benign by sonographic parameters. And this kidney is normal, showing perfusion, normal perfusion of the parenchyma. Saban kar lo beta. And with the normal waveform, so this kidney is, so the mass effect basically from this pelvic mass is on the right side more than on the left. So from the mass effect of this, by this pelvic mass, the right ureter is compressed at its distal region, and has given, we see the consequences of it in the form of hydroureter and hydronephrosis. Now, to see if there is any regional adenopathy or para-iliac region adenopathy, now if you concentrate, these are iliac vessels, and this is the lymph node in this region. So there is a lymph node in this region as well. This is a case with that we can say is that of an aggressive pelvic mass, complex pelvis mass with the mass effect on the right ureter, leading to massive hydronephrosis of the right kidney with para-iliac region lymph node enlargement, and with preservation of the right and left kidney. This is our case of the day. Thank you very much.